All right, welcome to Netilogue on CGTN. I'm Zoe in Beijing. Well, as the surge in the cases of coronavirus continues, cultural diversity has led to different approaches and sometimes misunderstandings in the fight against COVID-19 in different countries around the world. As part of our efforts to keep connected in the time of global isolation, we are honored to be joined on today's live webcast by internet influencers from the United States, the United Kingdom, Italy, Iran, Japan, and Israel. And viewers can also watch and participate. You can leave your questions or messages in the comment section of our social media account. At the same time, I'd like to also thank Weibo for their continued support of this program. Let me start with you in the United Kingdom, Zhang Peng. It seems the half of the world's population is now living in lockdown in one form or another. So life will continue, but with some restrictions. What is it like in the United Kingdom?
Well, initially, the UK citizens are not quite obey the rules. Well, before the restaurant shut down, they still go to the restaurant. But when government shut down the shops and shut down the restaurants, they seem to be now it's getting used to this right now, and also film some of their actions already. Like even they go to shopping, they still try to keep the distance, like 2 meters away. So 3 or 4 weeks after lockdown, and the social distancing rules are quite well in the UK at the moment.
And Leo, obviously, the United Kingdom is the last country in Europe, if I can stay as still a European country, to have social distancing. Is it working?
Well, we're certainly a European country, first off, always will be. Yes, it is working. Last night, the chief medical officer announced that the UK had already hit the peak of cases in the UK. And in fact, in London, the last few days, the number of cases has fallen by 5%. So clearly the measures taken are working very effectively. We're generally pretty confident that this is being well managed.
How do the British people see social distancing? Are they following the rules strictly, or sometimes they would try to step out of the comfort zone and do something that is not so accepted?
Well, there are always going to be people who don't follow the rules. And I think amongst the young, I think there are issues with rule following. But I would say that 90% or 95% of the people in the UK are very responsible. They care very much about the health of the country. And they're very receptive to the government's communications drive, which is not about protecting yourself. It's about protecting the NHS, our system. And generally speaking, I think it's been effective as much as it could be in a country like here. We're pretty happy.
What about in the United States, Christian?
Well, I haven't left my house in about 10 days. But
10 days?
Last time I was out, 10 days. In Maryland, here in the
Is it
Washington,
the first
D.C.
time in
area,
your
a
life
lot of
to stay at
people.
home for so long?
Yeah, I would say so. Well, I mean, 2.5 months ago, I was in Beijing, so I kind of went through the same thing, only going out for groceries. But, people are starting to wear masks and everything. It's now required in the state of Maryland to cover your face whenever you go out. However, there are places like in Michigan and Ohio that there are actually protests with thousands of people going and saying that we have to open back up, lock up the governor for trying to shut things down. So not everybody's complying.
Where are you now?
Washington, D.C.
In Washington, D.C. Does D.C. also worry about what happened in New York will probably happen again in D.C.?
So from what I can tell, testing hasn't really scaled up that much in this area. We call it the Washington, D.C. area, being D.C., Maryland, and Virginia. And actually, I went and got a test 2 days ago. So,
How about it?
well, from what we can see, I mean, I'm still waiting for a result. They said about 3 days. So,
Why did you decide to test yourself?
I've had a fever for about 4 days, body aches, soreness, sore throat. So,
Wow,
just to be safe, I
no
guess.
good.
Yeah, I've been sleeping a lot.
Did you get the result?
No, still waiting.
Are
just
you
isolating now. This is,
are you anxious
you know, my
about
dad's study.
the result?
A little bit, yeah. I mean, I guess it won't change much. I'm going to be isolating for the time being anyway because my parents are older. I'm staying at their house right now. And I mean, regardless of whether it's flu or, you know, coronavirus, I guess I'll just still be locked up here.
So, if it is positive, are you planning to go to hospital or are you going to stay at home?
I think the current policy is if you're positive and you don't have, you know, really severe symptoms, then you should just be isolated at home and then, you know, go to the hospital if you actually need to. So, yeah, I don't really know what else you can do. A lot of people are still trying to get tested in other areas and they can't get a test. So, I guess I'm lucky to get that much
So,
for the time being.
it's luck that you actually did get tested. Is that it? What is
So,
this?
I had
How
a
does the
video
system work?
appointment. In Maryland, at least, there's a testing facility about a 2-minute drive from my parents' house. So, I called a doctor. I had to have a video appointment first to describe my symptoms, and then he said that, well, it kind of sounds like I need to get tested. I don't have a really high fever. The highest it's ever gotten was 100, so about 37.8. And
What is
you know,
that in
I just don't feel very good.
centigrade?
37.8.
37.8. That's not high.
So it's just a low grade fever.
Okay.
It's just I just feel terrible. I'm sleeping a lot,
Drink a lot of
kind of
water
achy.
and eat well.
Yeah.
What about you, William? You're in Tokyo, I presume.
Yes, yes. In Japan, about 1 week ago, the state of emergency was declared by the Prime Minister Shinzo Abe. But I want to say the emergency state in Japan is very different from other countries because all the emergency measures are actually request based, which means it is not legally compulsory. Actually, the government is encouraging people to stay home and also asking the restaurants, the shops to limit or cease the operational time. But actually, because the state is not mandatory, some restaurants did close, but others didn't. People are also free to go outside and go to work, even using the public transportation system. And anyway, in the world, I think that the lockdown in Japan is a very soft one, and it is very reliant on the awareness of the citizens themselves.
But do people still go to work and do they use public transportation a lot?
Yes, it is said that only 30% would the transportation would decrease, and some of us are working from home, like me. And I believe most of the Japanese company don't have the system of telework or something like that.
So you chose to work at home, or you think it is in your best interests?
Yes, I was asked to work from home because my company actually reacted in at a very early stage and asked the employees to work from home. Maybe around I think 2 months ago.
And do average Japanese think the government's response was immediate and prompt and appropriate?
Yes, I talked with my Japanese friends about that. Most of them think the reaction of the government is very late compared to the neighboring countries, I think. Yes.
What about you, Roz? What is it like living in quarantine in Israel?
Hi, I'm right now in Israel, and the number of cases is around 12,000. For a small population like us, it's quite significant. So the country is in full quarantine, especially now during our holiday period, the Passover holiday. Getting together, and there's actually some cities on complete lockdown that they cannot leave, and there's nobody can enter or leave. Israel is taking it very seriously, and people are obeying the rules for the most part. Yeah.
What about Iran? Rezo, I know that Iran was probably among the first countries to see infections. And Iranians have religious rituals to go to. Do they stop? Have they stopped doing that?
Yes, yes. Hi, first of all, hi. I am Arizu from Iran, and first case of coronavirus has been noticed and reported on 19th of February in Iran, and up until now, by having around 75,000 cases, confirmed cases, and around 5,000 death cases. Already, our country is the most affected country in the Middle East. So, in response, our government tried to take some steps like stopping schools and universities and let them just continue working online, and also stopped some public events and celebrations, important celebrations, and also stopped the Friday prayers and holy shrines and things like that. So, of course, at the beginning, some people were unhappy because of all these lockdowns and everything. But nowadays, everything has become to normal. I mean, people have used to that, and there is no complaint about that thing. And in Iran, there is no official lockdown or quarantine on any city or any area.
So people
But
still
of
go to
course,
work
government is
and
trying
taking
to
public transportation?
encourage people to social distance.
I just asked you, Rezo, do people still go to work in Iran
Yeah.
like usually they do?
Yes, yes. Working in hasn't stopped, and there is a reason behind that. That is Iran's economical situation. Well, under a sanction, so
Okay, it
I
seems our line
cannot
is
stop us from going to work or working.
our
There
line
is
is
no
not
support
working
from the
so well,
government, so
Rezo. What about Aldo? Aldo, you live in Milan, and northern Italy is heavily battered by this coronavirus.
Yeah.
What is it like in Milan?
So Milan, as the whole country now is in lockdown. We started on the 7th of May, and we will continue for now until the 7th of March. Sorry, and we will continue until the 4th of May. For now, after we will see. For now, the cases are lower every day. So the situation is getting better, but I couldn't say good. And in Milan, actually, is yet not under control.
And people stayed at home.
Yes, everyone. Yes. I think everybody here knew, maybe a little bit late, but everybody understood that this situation was really serious. So once this got serious, everybody stayed home, and I think people is doing everything to everything possible, to avoid getting in contact with others, and yeah.
And the death toll in northern Italy is simply scaringly high. Are people afraid?
Yeah, I think people are afraid. Yeah. Now the good situation in the northern of Italy is that we have more than half of places in intensive therapy are free. So if someone gets ill very badly, they can cure you. That situation was really bad, like something like 2 weeks ago, because
Uh-huh.
there weren't places enough for all people.
And Lila, what's it like living in quarantine? Are you living in quarantine now?
Yes, right now, all of California is under shelter in place. So, yeah, I've just been staying with my family, and we've been all trying to work from home, across a lot of different time zones, which I'm sure you've been experiencing also. We have people right now from different time zones, so it's a little bit hard to manage, but we're trying to keep producing content, keep putting out videos.
A lot of people say that COVID-19 is a game changer for many of us. I like each and every one of you to tell me what is the most difficult part of living in quarantine and what is the satisfying part of it? Why don't we start with Lila? Lila?
I think the most challenging thing is being away from my friends because I really miss them. Um, and I also miss hot pot and spicy crayfish and stuff.
Who don't?
But I know that I can have those back one day.
Yeah, you
And then I
will.
think the most rewarding thing is that even though it's a really difficult time for our team at Y China, we've been able to, all really stick together and put together our strengths and work through all of the differences, whether it's problems with the internet, whether it's time difference problems, whether it's communication difficulties. We've, really been able to um, work through it and keep putting out content, keep doing what we do.
Yeah. And what about Leo? I was told that you grew some vegetables in your home.
Yes. Well, I think part of the joy of being at home, of course, is you have a moment to reconnect with nature. And I think that's been a very important part of the process for many British people. We're very lucky. We have some room inside the UK and a lot of people have gardens. But at the end of the day, there are two big things. The most difficult thing for me personally is to be away from my wife. She's in Shannon. And so we don't want to be
Shaman.
separated as a family. Yeah. And the most joyous thing is to be together with my children. And that's the most difficult thing for her. For all of us, I think that the joy and the pain is all based around family. And, for us in the UK, we know many, many Chinese friends who have their children and their friends in this country because we have a lot of foreign students. And so I think one of the most painful and the most satisfying things of being an influencer has been able to talk to the parents and on a day-to-day basis, give them information and give them reassurance where we can give reassurance because everybody's very nervous. It all comes down to people in the end.
Wow. That's really a nice way to put it. Zhang Peng, how about you?
Well, for me, work is not a problem because I've always used to working from home, even in my blogging business. But one of the most challenging thing is to getting enough food because my parents visit me because I have a baby born last year. So all my parents and my parents-in-law are here. So we have a big family household here. It's hard to get these foods delivery to us. It's hard to go outside because in this environment. And for other things, it's always hard to meet our friends, together our friends to have some social works. But every country is making good progress these days, and even in the UK. So as the Queen says, we will fight this, and we will meet our friends again, and we will meet our families again. Yeah. So
Yeah,
just
we
facing.
definitely will. We definitely will. William, what about you? The good and the bad part of living in shelter in place?
Yes, I think generally things are going well here, but there does be one point that is worrying me because my wife is now pregnant now actually and going to give
Oh,
birth in a,
congratulations.
yes, thank you, and going to give birth actually in around 1 month. It's very, yes, it's very soon. So that's the point currently I'm really worried about. Because my wife is Chinese too. Under such situation, travel from China has already been closed. It is stopped. So me and my wife's parents are not able to come here, which means at least for some period I have to take the full responsibility to take care of my wife and the upcoming baby. Yes. Anyway, at least I think I'm already mentally ready.
Uh,
Yes.
that will probably make you a better dad at taking
Yes, I will
care
try my
of your
best.
kid by yourself.
Yes.
And Arezzo, what about you?
Yeah.
What has living in quarantine taught you?
Well, living in quarantine, of course, it is a little bit hard. It's almost about 2 months that I am in quarantine, and I have been spending my time with my family. And because of my job, because I am a tour guide, and before all these things happens, I used to travel from one place to another, one city to another, one country to another. So now I have a chance to spend more time with my family, and I am happy because of that. So see, everything
Well,
that happens, there is a dark side to that, and there is a positive side to that. So I
as
see
you
the
said,
light side, and
you're
I
a
am still
tour
enjoying
guide.
that.
Isn't very torturous to be stuck at home and without any tour group to guide?
Well, it is so hard. Even thinking about that, it is so hard. But I am enjoying that in other way.
What way?
Just like spending time with families and improving myself in different levels and different things and planning for my future in a more serious ways and things like that.
Uh-huh. That's great. More time with family
Yeah.
members. This is really an occasion for all of us
Yes.
to celebrate some quality time with
So
our
I
loved ones.
appreciate this time. Yeah.
Aldo, you play the
Yeah.
violin
Yes.
to
So the
lighten up your mood.
bad things about this for me as a musician is that for me it's difficult to think about when uh, when I'll be able to do my work as before. It's so difficult. So if you think about people like 1,000 people closed in a theater going to a concert without the proper distance, is so difficult to think about. But the good thing is that I'm home with my family, so I have my wife and my two daughters. They are 1 and 4 years old, and the good thing is that we are together. We are taking everything that can be positive from this situation. So we are a lot together. I'm knowing better them, and I will see Victoria, my younger daughter. She's doing her first steps in these days, so I will be able to see her doing her first steps.
Uh-huh.
Uh, Other good thing is that I thought I
Great.
could do nothing for others, but when I started playing online for people outside and for my neighbors, I understood I could do something. So give hope
Yeah.
to a lot of people, and that was a very nice surprise for me.
Indeed, you actually feel closer to your community when
Yeah.
you're spending a lot of time at home. Yeah.
Yes. Yes. Hmm.
And I know, Christian, that you got a chance to take a up close look at the temporary hospitals in your area. What is it like, and can the U.S. public health system
So,
handle the pressure now?
I mean, in Washington D.C., it's not as severe as in New Jersey, New York, Michigan, but the place that I went to, it was actually just in a parking lot of a little shopping center, with a 7-Eleven and like just a little pharmacy, and they just told us, all right, we're going to be doing the testing at 6:30 p.m. So I pulled in the car, several other people around there waiting for a while, and it just kind of was weird, like tension, because it's generally like a fairly empty, unsuccessful shopping center, and then all these
Mm.
cars started pulling up with nobody getting out, so we're just sitting there waiting, and then finally all these people came out, in their protective outfits and everything,
Are
fully
there a
masked
lot
up.
of patients in those pop-up hospitals?
So I mean, this wasn't really a pop-up hospital, but rather a testing site. So we had I saw about 25, 30 cars, and they would just come up to your car. You had to show them your ID, and then they come with the little swab and just all all the way into the back of the head. It's not very
So,
comfortable.
so you don't actually see medics when you are doing the testing.
I mean, so there's just one nurse that comes out, and she checked my ID. She had the swab in one nostril and the other nostril, and then quickly roll up the window and then tell you to go. So it's just very, very quick. They don't want to spend much time talking to anybody. I actually had my window open a crack in the beginning, and they just said, no, let's close it up, close it up.
So they were also afraid of being too close to you.
I guess so, yeah, just because I do know that the hospital that's about 5 minutes away from my house, it's the one that I was born at, they're currently running out of PPE. So, they have to ration all of the supplies that they have, the masks, the protective gear and everything. So they're being very careful. They don't want to have any unnecessary exposure.
And do you worry that you will get enough care if you got infected?
I guess because the system isn't overloaded here yet, I'm not too worried about that. If my systems, God forbid, were to get more severe, I'm more worried about my parents because I've been helping them out. I've been doing all the shopping. My dad's 93, my mom's 71. So for me, that's my primary concern. And my wife is now taking over that role that I'm just, locked up here feeling kind of helpless. So that's what's frustrating.
And did you pay for the testing?
No. I bought insurance because I live in China full time. So I bought insurance the day that my wife and I landed in Washington, D.C., just assuming that we'd be here for 2 months or so. And then when I found out I needed the test, they said that actually the insurance that I got fully covered it. So the consult with the doctor, the test, that was all free. And if you don't have insurance, the current policy is $125.
$2,500 for a test.
No, $125.
$125 for a test.
Yeah.
What about Lila in California? Is the same? Insurance pay for the bill?
Yes, your insurance will pay for it, and most people have insurance here because we have like policies. But I don't know about that. I just know that I'm okay, but I don't know too much else.
Because a lot of people are wondering what kind of access to testing there is in different countries. Maybe some others can also chime in here. What about in the United Kingdom? Do people pay for the testings? Leo?
So in the United Kingdom, we have a 100% free national health service. Every element is free at the point of use. So no one is paying for any testing. No one is paying for any treatment at all. The issue right now, of course, is that we don't have enough testing, and they're fighting very hard to increase the rate of testing to 100,000 tests a day by the end of the month. We're quite a long way from there, but I think we'll make it. But no, we have completely free healthcare for every person inside the UK, including our visitors.
What about in Israel, Raz?
In Israel, we have a very special testing system. First of all, it's all for free. Secondly, they come to your home. People come to your home to do testing, especially for the elderly and the people that cannot leave.
They come to your home.
Yes, the testers come to your home dressed up in the suit, and they take it for two minutes and they leave.
Because it's easier for you, but
right.
It's cumbersome for them.
Right, it's dangerous for them, and it's a system mainly caring about to protect the hospitals from possibly being infected by people going to the hospital, to the centers of the health, and also for people who cannot leave their homes, like maybe very elderly or people that are have trouble getting to the hospital. So it's a unique system, and they have people really everyday testing, running around. I have a good friend of mine, one of my best friends. He's a paramedic. He's a medic, and he goes and tests around 50 to 60 people a day.
But probably not many countries can afford to send their medical doctors to homes to do the testing.
That's true. Yeah, it's a unique system, and it's helping to increase the testing and keep people safe. But obviously, we hope all the doctors and medics are being safe and careful when they go and keep the society safe.
And what about the infection rate in Israel? Can the medical facilities still cope with the surge of infection cases?
Right. So Israel's infection cases 12,000, more than 12,000, which is quite high for a small country. However, there is not many seriously infected people, and not many people are in hospital beds. And there's only about one. Not only, of course, there's more than 100 deaths, but the death rate is lower than 1%. So the pressure on the health system is not extremely heavy yet. Israel does have hotels just for the coronavirus patients. They set up hotels just for them and keeping an eye on them. For now, it's okay, but obviously we're doing everything to be cautious by purchasing more beds and more breathing machines and making sure that the system will be ready if it gets worse.
Yeah.
For now, it's been okay.
I know that Zhangpeng, you had a chance to videotape some of the VHF facilities doing testings. Was it like to do testing in the United Kingdom?
Well, that's at the early stage of the coronavirus, where you can still have enough testing facilities to test those patients. That's at the early stage. But so they have this testing port, so to isolate these people who need the test, so that they don't need to go into the hospital. They can just test it outside the hospital. But after in early May, when the pandemic broke out, UK doesn't have enough facilities to test all the people. So the testing process are limited to those patients who are ill enough to be admitted to the hospital, so that the doctors know whether he got coronavirus or not, so that the treatment will be in accordance with that. For any other patient with mild symptoms, they will never get tested. But since 1 or 2 weeks ago, the government are extending these testing capacities to these NHS workers who show some symptoms in the past but who want to go back to work, so that they will get tested these days, so that they will know whether they can go back to work or not.
So it seems that we don't know how widespread is this in the United Kingdom, since not a lot of people have been tested.
No, we don't really know how much people actually are infected in the UK, because up till now, we're still testing only patients who are admitted in the hospital, who require hospital treatment. So that's why we have a very high infection rate. We're testing around 11,000 people each day, and around 4,000 to 5,000 are test positive. And we have a higher death rate because for all those confirmed cases, there are very ill people who need hospital treatment.
And Leo, a lot of people are asking, well, this virus seems to be spreading in Northern Hemisphere, and most of these countries are advanced economies. But still, there are a lot of vulnerable people, the elderly, and the poor people. Should the government protect them better, and what should the government do?
Well, I think it's a really important point, and I think it's been made across the nation in the United Kingdom. But we have three groups maybe of people that we need to be looking at. I mean, one group is the elderly, another group is those who are already ill or have a weakness, and the third group, of course, is the homeless. And I think we have a mixed record. I think when it comes to people who have medical issues, then I think we've been very strong in getting them isolated and watching out for them. I think when it comes to the elderly in homes, we've been very strong in looking after them. There are now 750,000 volunteers delivering food for them, looking after their lives. And that's a wonderful community-based effort. With the homeless, we've done reasonably well. The government has paid to house every homeless person in the UK, but we haven't been able to actually do that. We've got about 70% homed, and about 30% yet are still on the streets for whatever reason. So there's a little bit of a lack there. The really big problem in the UK, one of our big three challenges, is that in the old age homes, where we have a lot of people who are, the last 5 years of their lives being looked after by medical staff, actually there's been a lack of resources in this one area. And we've seen a huge number of cases in the old age homes. So, this is one of the big three thrusts of policy this week, is to try and really put money and resource into the old age homes. That's something that's scaring all of us, but it's being managed.
But do you think the NHS has been handling the medical service well? Because people are saying maybe it outstripped their capabilities. They are already in the phase of rationing their healthcare at the moment. Are we there yet?
No, I think actually the NHS I think most people feel the NHS has managed the epidemic really very well indeed. However, they, at a very early stage, rationed everything so they could create the capacity to manage with the epidemic. If we take an example from today, we have more empty beds in emergency healthcare today with ventilators than we actually had 1 month ago before the epidemic started. So we've created more capacity that we haven't used yet than we ever had before. And the number of cases is falling. So in terms of actual management, it's been absolutely fine. But how have we done that? We've done that by cutting off every single case that we possibly could and pushing them back into their homes. So there's a lot of people who are not getting medical treatment. And I think in a month's time, a lot of people with smaller, lower conditions will be moving into the hospitals very quickly. And that'll need a lot of management.
All right. As this coronavirus continue to spread, we seems to have seen people doing things otherwise they wouldn't do, like hoarding goods, like pasta, toilet paper, canned food. Is it happening everywhere? Let me start with Lila. Lila, in California, do people in a rush to buy stuff, although they might not use them very soon?
So when when San Francisco first ordered a shelter in place, those few days, people were definitely purchasing more than usual. Like hand sanitizer, pasta, canned foods, and toilet paper. But they've been increasingly putting limits on the sale of these items, saying only take what you need, limiting it to 1 or 2 per customer. Just let people stop, hoarding items. So I think
What
that's
kind of
helped a
stuff
lot.
do they rush to buy?
Anything that will disinfect, so like hand sanitizer or disinfecting wipes, non-perishables like pasta or canned food, and then of course toilet paper, which I think is the only thing that I haven't seen an improvement on. Like now when I go to the grocery store, it's most like everything is in stock. They might be low on stock, but the thing that they're still out of is toilet paper.
And William,
Yeah.
is it the same in Japan? People are buying all kinds of stuff? Anything that's
Yes.
particularly Japanese?
I think at one time in Japan, people did rush to buy a lot of toilet paper at one time because it was resulted from a rumor on the internet. I think the rumors was saying that most toilet paper in Japan are made in China, and because of the impact of the coronavirus, all the factories in China are stopped. So it is very urgent to buy something like toilet paper before running out. Yes, that's the reason why people rush to buy toilet paper during that time.
And Christian, are you okay? I saw you just coughed a little bit. Did you buy
Yeah,
did you
just
buy
a
enough
scratchy throat.
to keep in stock?
I'm fully stocked up here because when my wife and I came in at the beginning of February, I had my mom go out and buy a couple masks. I mean, I have like a box here. We probably have about 200, and I donated a couple to the hospital nearby.
Okay.
But hand sanitizer, all the stuff that we need, we've got it.
So
Because I mean, same as Lila, as she saw, we
don't
can't
do
buy a lot of stuff.
shopping now.
No, I mean, I was doing the shopping for the house, and I kind of got sick about 4 days ago, so we haven't done any shopping in about 8-9 days. Though we got delivery from the Chinese supermarket yesterday.
You got
So
them
there's actually a
delivered so that
service.
you don't have to go
Yeah.
there yourself.
Yeah.
What about Israel, Roz? Is supermarkets working good? Do people
Yes, they still open,
line
but
up
in
to buy?
Israel, the main situation is because it's a very big holiday for us, Passover.
Yeah,
So
that's a
there's a
big
lot of
holiday for Jews.
yes, it's a very big holiday in the Jewish calendar, and for some reason, eggs were in short supply. People
Eggs?
could not buy eggs, and there was a big rush.
Yes.
My mom went to the supermarket, and she always complained there was no eggs for around 1 week. You just couldn't get it, and then the Israeli thing was, in Israeli government, they did a massive purchase of eggs from Turkey and Spain, and they flew it literally right away just before the holiday, so people could have eggs, because a lot of the dishes we cook in our food involves eggs.
Okay.
So we solved it. I think now you can only buy 2 cartons of egg per family, like per shopper, like about I think it's about 40 eggs or 20 eggs, like or 30 eggs per person. Yeah, but that was the main situation. Everything else has been actually okay. Of course, people are trying to get masks, which is still hard to get. But besides that, we don't have the toilet paper rush for some reason. We don't. We're okay with toilet paper in Israel. Nobody was rushing for that.
Okay. Aldo, what about Milan? Because I know the
Milan
Italians are very social creatures. They like to hug, they like to hang together.
Yeah.
But what about now? Do they still go shops and keep a distance?
Now, yeah, Italians are now. I can say they changed a lot. It's very difficult, I think, for everyone, because we are used to be very close to each other. But I think people is doing good now, and we are keeping the distance. We are getting, maybe losing our essential. How do you say? It's our essential. How do you say that? Like
basic, good.
Yeah. So, but I think people is keeping distance, and everyone is wearing masks for going outside, and it's also you cannot go outside without a face mask. And and for the groceries, we had some problems for one day that everyone was going and taking everything, but the day after everything was there, so it was just one day issue,
I think toilet paper is really
about wearing masks, because that's really interesting. 2 months ago, everybody wore masks in China, in Japan. But many Western countries say this is strange. It's just unreasonable for healthy people to wear masks. But now it seems everybody is okay wearing masks. Why there is a shift of attitude there? I want each and every one of you to weigh in on this. Leo, is British comfortable wearing masks?
Well, I think there are 2 issues. Firstly, we have no history of wearing masks, of course. China has been through SARS, and China has been very concerned about air quality issues. So they have 20 years experience in wearing masks, and we have none. But I think the deeper issue is really a government-driven issue. There actually are not enough masks in the world to meet the needs of the world during the epidemic. China produces 90% of all the masks in the world, and China produces 116 million every day. Now, there are 40 million doctors and nurses
China is
in the
now
world.
selling to the rest of the world.
And China is giving them away, and everyone appreciates that enough. But if you think about it, there's 40 million doctors and nurses in the world. If China produces only for them, there is still not enough for them to use for one single morning every day. So what the British government did at a very early stage, it said to everybody in the country, wash your hands, stay at home, you don't need a mask. And I think what they really meant is leave all the masks. We need them for the nurses and the doctors. And they made a huge effort to stop the public buying them. Just keep them at home, wash their hands, and make sure all the masks got to the people who need them the most. I think that's really what's driving it.
I had some experience buying masks in the early stage of the UK. So before the coronavirus broke out in the UK, I tried to buy masks in the UK. I spent like 3 hours online, but I only managed to get like 1 or 2 packages of masks. And the other day, I tried driving around London for around 4 or 5 hours, taking different parts into this builder's shop to get those like dust masks. And after 5 hours, I can only get like 9 masks. So this is only for myself. But what if the whole public would need masks?
You mean now, or you mean a month ago?
That's like a month ago, just early March.
What about now?
Now it is still hard to let the public, to everyone, get the mask unless you go into some small shops. You can buy a mask for around £5, which is a really high price. But from what I observe, anyone who are able to get masks, they will wear a mask when they go outside. So a month ago, probably 1 out of 100 people wearing masks, and most of them are Asia. But since last week I went out, it's like 1 out of 10 or 25 people wear a mask, and lots of them are British people now.
So they have changed their mindset apart
Yes,
from the availability problem.
yeah, as long as they can buy it, they can get access to masks, they will wearing. That's what I'm sure.
And William, it
I
seems
think
the
that's kind of the
Japanese.
situation here as well.
Yes, yes. Christian?
Yeah, I mean it's kind of the same here as well. I mean, I had a friend, Brian, who's also part of Why China. He came to visit the U.S. and we went out and filmed a couple of videos. And kind of near the end, we realized that we can't really go out much anymore. We were wearing masks and we were getting a lot of really dirty looks from people. That was around March 9th, the last day before he went back to Beijing. And then, over the last couple of weeks, kind of like Leo said, we had a lot of conflicting information. We were told you don't need masks, but it wasn't really you don't need masks. It was we need to save them for the doctors. So now we have like a lot more people who are starting to hear, okay, you should cover your mouth. And now that's the official policy in California and in Maryland. You can, if you're not wearing a mask in a supermarket here in Maryland and the Washington, D.C. area. So you you can't get a mask necessarily, like a surgical mask or an N95. So you just have to wear a scarf, or, people, they'll wear ski masks, things that usually would scare people if you saw them outside, but now that's kind of the norm.
But do people understand in the US why there is a shift of policy? Why it works better to wear a mask?
So I think the biggest issue is that because we had conflicting information, they didn't say why it was that we shouldn't be wearing them. A lot of people just thought like, oh, they don't protect us. That's what a lot of people said. The mask does not protect you. Therefore, the people that heard this message and didn't want to wear them anyway, they just kind of took that, ran with it, and decided, all right, masks are for people who are sick. And that's why a lot of people still got dirty looks. And now they've slowly started shifting the rhetoric. And I mean, in Washington, D.C., at least people are wearing them. I don't know what it's like in California. Maybe Lila can weigh in on that. But here, people are slowly starting to get the message like, oh, yeah, you need to cover your mouth because of, asymptomatic transition.
As far as I
and all of that.
understand, because there are asymptomatic people, that means even if you are not sick, you can still carry the virus and spread it to others. So it's better that you wear a mask to protect others from infecting from you.
Exactly. Yeah, I don't know why it took so long to get that message across. It seemed very obvious. As someone who I study finance, like I work in language teaching, like it was very clear in a lot of other countries' rhetoric. A lot of people knew that, asymptomatic transition, you need to wear a mask because you don't know if you're sick or not.
Yeah.
But that was frustrating.
Yeah, that the messaging obviously has some problem. How the government communicate messages consistently to the public. But it seems that the Japanese are always okay to wear masks on the streets, in offices. There must be some cultural elements behind this. William?
Yes, I think so. The Japanese people always have the habit of wearing masks, even long before this pandemic, I think. There are multiple reasons for that. I'm not sure, but there is one reason I'm pretty sure. It is in spring, many Japanese people are actually allergic to the pollen, which causes symptoms like sneezing and runny nose. And that is one reason. And there is another one kind of fun, interesting. It is also said that young Japanese girls are wearing masks to cover their faces. If they don't want to make up that day or for fashion only. And because of that kind of culture, yes, I think so. I think so.
Is fashionable to wear masks?
It depends. It depends on the kind of mask.
Wow, that really beat me. What about the Israelis, Roz?
Oh, in Israel, yeah, I've been wearing mask every time. In here, actually, people there's mixed messages, but I think there is an acceptance and understanding of the concept. There is an interesting phenomenon that happened is that about 2.5 months ago, we together donated masks from Israel to China. to Hubei province. And then now we actually received donations back from China to Israel of masks.
You're welcome.
So it's been a very nice to see the peoples of the two countries helping each other in this time. And of course, people need to understand that wearing masks is important. But it's very clear in Israel one thing, that the N95s must be given to the hospitals and the nurses. KN95 and the normal surgical masks are fine to wear, but try to leave the N95s to the hospitals, and also don't charge very high prices. I think there's a big movement, some kind of protest online to stop raising prices and trying to sell it for so expensive. This is something that's going on here. People are trying to make masks cheaper, and luckily we got a lot of donations from Chinese people, from Jack Ma. Actually, he gave a lot of
Jack Ma.
donations of masks from the different Chinese local governments. I had people, all our fans have been messaging me. They want to send things. I'm sure people here received. It's been very moving to see people coming to help each other during this time. So I hope people stay strong and we'll get through it.
Rezo, I noticed that you're wearing a scarf, but do you also wear masks?
Well, in Iran, it is not weird to wear a mask because in Iran, in so many big cities, there is pollution. So even before this coronavirus things happen, people were still wearing masks and everything. I mean, not all of them, but some of people tried to wear masks and everything. So it was not weird. But after this coronavirus situation started, even though in Iran we have no rule to say that you have to wear masks, but still most of people do. There are a little number of people that don't, and that is because after the coronavirus started, the price of the mask increased. And that's why some people cannot afford it to buy a mask. Otherwise, people would wear it, and we don't think it is weird.
Yes, there are a lot of people worry about. Probably masks is the least of them. A lot of people are living anxiety, uncertainty, and sometimes desperation. You are influencers. You are opinion leaders in a way. How do you help your followers cope with psychological strain and emotional stress? Leo?
Well, we have two different audiences to deal with. I mean, all of us are talking to a Chinese audience, and I think their greatest fear is that their loved ones could be at risk. And so the key thing we can do is give them very transparent and direct information and try and tell the truth so they can make a judgment for themselves about how they need to manage things. I think we also have an audience in our own home countries, and that's a very different audience. So I was lucky enough to get together with some friends, and we started up a non-profit called 66 of Us, which represents the 66 million people of the UK. And what we're doing is we're getting communities to teach each other new skills while they're during lockdown. It's just an attempt to make sure people are teaching and they're feeling the support from their community. And I think there are a lot of things going on like that in the UK, and I hope there'll be more.
And Jampeng, what messages do you tell your followers?
Well, basically, during this pandemic, I divided my stories into two parts. One is to deliver a clear understanding of what these coronavirus is happening around the world, and especially in the UK, so that people know what's happening, so they don't get afraid of. And the second is I keep posting some stories about uplifting stories, about warm stories, the good things happening during this coronavirus, and also some stories outside this coronavirus, like things happening normally in this world, interesting, warming stories. So people are not, one thing, they know what's happening, they don't keep it blind. And secondly, they can still read some good stories, so they keep their life open, to keep their life warm. So that is my way of,
some sense of normalcy.
Yeah, exactly.
William,
that's very important to do.
Yeah.
William, what about you?
Yes.
What do you tell your followers about your life and your problems?
Yes, I really agree with Leo. I think it's very important to update the real-time information to the followers and to let them know the real information, keep them updated. And also, I think sometimes there is no such a straight way to comfort the emotion. So what I always try to do is to post many interesting pictures and videos to make them happy, because I know being happy is the most effective way to stay mentally healthy, I think.
Yeah, being happy is so important. Rezo, are you happy?
Yes, of course.
How do you do to keep your followers happy as you are?
Well, during all these days, I have tried to use different things in different ways to entertain, challenge, and encourage, and of course, motivate my followers. I mean, by having some cooking challenges, and also sometimes even by telling them all the positive things that this situation, the virus situation, brought to the world, brought to the humanity. And also sometimes I even try to use this to use my platform to just tell some stories to Chinese people, because I know Chinese people love hearing
Yeah.
stories, especially when it is a real story from another culture. So they want to hear that. So it's a way to keep them entertained, to keep them happy or distracted from whatever that is happening in the world.
Yes, yes, indeed. And the cooking lessons definitely help. All of us have gained weight.
Yeah.
Aldo,
That's true.
Aldo, what about you?
Yeah. What about me? I try to communicate with my followers that we, despite the distance, we are
Well, it
getting
seems
closer every
I
time.
can't hear you, Aldo.
Oh, I don't know what's happening.
Oh, okay,
What
okay, it's
about
okay
now?
now. Keep
Okay,
keep
okay,
talking.
okay. So I try to communicate with to my followers that there are good things, to do. So I share my music with them. I play on the balcony for my neighbors and online for the whole world, and I give them company. For that 10 minutes a day, uh, we fly away from this world, from bad news, and we just enjoy music, and it's a very good thing. I think, because it gives hope and company for people who's alone home. And
Yeah.
another message that I am giving to everyone is that we are together in this. And even if we cannot hug each other, we can hug our souls.
Mm.
So music is one, it's a very, it's a world's language, so international language. So even on Weibo, if you could see, there were a lot of musicians from China who joined me on my balcony concerts. So we played together
Mm.
online, and it was so emotional.
Yeah.
It was so touching because it was like a message of solidarity. We are together in this despite the distance, and this I hope we will keep this.
I
Yeah.
have a question for Aldo actually. For those
Yeah.
balcony concert, we have loads of videos showing that. But is it like a
Yes.
certain just done this in a certain period, or is it more like a daily routine these days?
It was a daily routine for 22 days because initially the lockdown in Italy had to start. It started on the 7th of March, and it had to stop on the 3rd of April. So every day from there, actually I started on the 13th of
Mm.
March, and I played every day at
Wow.
6 p.m. here in Italy for my neighbors and online on my social media.
Oh,
And it were 22 concerts. And after that, I have two daughters, and they're very, very, how do you say, small. So I wanted to give them more space during this quarantine. So now I'm playing like once or twice a week,
oh, that's really nice of
because
you.
this will continue for a lot,
And it's
here,
really
a
beautiful.
month, but maybe more.
It's really beautiful, as you put it, to hug each other's soul. That's really
Mhm.
beautiful to put it. Christian, what about you?
So I mean, I guess for everybody, it's changed how we do our daily work and just socializing with people. So over the last month or so, I've started doing a lot more live streams to just talk directly to my followers. Like I'm a very extroverted person. I love, just seeing people face to face talking. And with all the White China people, we said bye for the Spring Festival and said see you in
Oh,
2 weeks.
that must be
We haven't seen
kidding
each
to
other in two
stay at
months
home
now.
all the time. You can't socialize
Yeah, so
face to face.
the live streams have been really helpful, just to be able to help me psychologically, mentally stay sane, but also just to be able to interact with people. And we've kind of mixed up our content, having a little bit talking about COVID-19 and the whole situation, so people do know what's happening. I start every live stream with, hey guys, today is April whatever, there are however many cases. And people always ask me that, and then we still continue with the normal stuff, because as Zheng Peng said, like, you need a sense of normalcy. You can't
Yeah,
just only talk about COVID-19, otherwise you'll go insane.
yeah, indeed. Roz, how do you get connected with your followers?
Oh, I mean, it's amazing to have followers. First of all, it's an honor to people to follow everyone here, that we are able to. We have this responsibility to share and to give hope and to give good energies. And I think the one thing that we focus on in this time is to give the people positive energy, as everyone said. Amazing stories. I'm very moved. One thing that I'm doing besides just trying to, as I say, to create as much positive messages to people, is that we're trying to. I hope people do not use this opportunity to discriminate other people for their race, for where they're from, for where, like, there's been so many negativity around. So I hope that everyone watching this, if you see anyone being discriminating others, just try everything to tell them to stop or fight it. We need to shut down all these voices of people trying to put people down. And I'm gonna keep doing this here with White China and everyone here. We should
Yeah,
not discriminate because this epidemic is an opportunity for us to come together, as everyone said here, rather than discriminate. And I hope that everyone, this message
yeah.
is going to be clear.
Yeah, that's
That's it.
really
Totally
important,
agree.
Ross. Those racism messages are really poisonous and hurt a
Oh, yeah.
lot of feelings. And what about you, Lila? You still reach
Um,
out to your followers?
yeah, so I mean, I think it's a really interesting question because I think a lot of content creators are kind of struggling thinking what kind of content should I be making at such a sensitive time, and viewers are also, thinking what should I be watching. So to be honest, I think that there are two ways of dealing with the pandemic as an influencer. So I would say one is to address issues and provide a platform for discussion, and the other is to provide an escape for those kind of who want to break from hearing all of like the COVID-19 related news articles and things like that. So I think that at Why China as a platform, we've provided both. We've addressed issues like discrimination and rumor spreading that are really important to bring to light and open a dialogue about. But at the same time, we've also been releasing more lighthearted videos so that viewers who are feeling distressed or bored can kind of like hang out with us, and hopefully we can bring a smile to their face during such a difficult time.
Wow. Well, thank you very much. Thank you to all of you for keep up the good work and connecting with your followers and passing on those information. Now, we'd like to answer some questions from the followers and the social media users. This one from Flying Priscilla. I think we kind of touched upon this topic. Why do Western people hate wearing masks? And even people laughed at Italian senators with masks. Why do Western people hate wearing masks? Wow. I should probably turn this uh, to, to Aldo. Aldo, why Italians hate
Yeah,
wearing masks? When they see their senators wearing masks, they kind of very angry.
I don't think they hate wearing masks. They weren't used to that, because it was the first time in history in Italy that they used face masks. So it was very difficult to change our mind. It wasn't that like they hate it. it's like something new for everybody here. So I think that was the problem. So people needed time to get used to that.
Oh, we have another question. Let me have a look. This one from
Yep.
Alice in Wonderland. This is to William and Zhangpeng. Have those Japanese and UK designers designed fashionable masks? Well, this is about fashion. William, uh,
Yes.
are there any fashionable masks to wear rather than just those dull masks that we wear every day?
Yes, as far as I know, it was a boom between the young people, especially the young girls, to wearing the fashionable masks. And some of them actually designed by very famous designers.
How fashionable can they be?
Okay, yes, it's very hard to define what the fashion is. If there is a boom between some age, some people, and everybody want to learn from them and want to do the same thing. And I remember, yes, maybe 4 or 5 years ago, it was very popular to wear mask with a little single logo here on the
Okay,
right side,
with
and
some
that was the
colors and
fashion.
patterns on the masks.
Yes, yes, an
Yeah,
icon or
that
a simple
that
color.
makes sense. At least to show your personality, you show that you're kind of have special tastes about your apparel.
Yes,
But
correct.
I guess, Zhang Peng, you don't have the luxury of choosing masks at all. You don't have
No.
enough masks.
No, we don't. They even in UK it's limited to like surgical mask or these like builders mask for the dust mask. There's basically no fashion at all. But ever since this pandemic, some fashion companies like Burberry has started making masks. But even the mask they made,
Burberry?
it
A
yeah,
Burberry
Burberry,
mask? How much
yeah,
would
Burberry.
that cost?
I have no idea, but it just strictly delivered to the hospital directly, I think.
Okay.
Oh, this is. I have another question on Twitter from Sienna Esposito. Guys, where do you want to travel once the travel ban is lifted? Well, that's a very personal question. Leo, where do you want to travel to?
Well, right now my wife is in Xiamen and her parents are in Wuhan. So I want to go to Xiamen and Wuhan and I want to
Wow,
see family.
you definitely should see Wuhan.
Yeah, I want to see my family.
And Champang, where do we want to go?
I'll probably go back to China then, because my parents is go back to China. Welcome is going back to China probably next month. But after all this happened, what I want is just go back because I've been staying here for quite a long time.
Where
Staying at
to
home
be
for quite.
exact? Where to be exact? In China?
Probably my hometown, Nanning, and
Nanning.
also my wife's hometown, Xi'an. Visit both families, although they are here at the moment. But at this end, we like to go back.
Hopefully,
So that
you can.
yes, so that my grandparents and my wife's grandparents have a chance to see my baby, because ever since the baby was born last August, we still haven't got a chance to go back yet.
I bet they're dying to see your baby.
Yes.
Arezzo, what is your plan for travel
Yeah.
as a tour guide?
Well, besides traveling to China, I also have planned to go to two other countries. One of them is Japan, and the other one is Finland.
Welcome to Japan.
Wow, that's two very
Thank you.
different places, Finland and Japan. How about you, Aldo?
Yeah, I chose Japan because it's mysterious.
Mysterious. Aldo, where do you want to
I
go?
would love to go to China because this experience made me know more about your country, your tradition, your music, your people, and I love it. So I would love to go there to play for you in public, in person, and to know more about your culture. I love it. So I would love to go there.
Where specifically?
China.
I mean, which city?
Oh, lots of cities. I've been there in Shanghai in 2011, but I have been just 1 day and a half, so I couldn't say I know your country. I would love to know Beijing, the capital. Yeah, I would love to know lots of cities, and I think every city has something particular to learn about. So I will to visit lots of cities in the country.
Yeah, then you must make a lot of time. There are simply too many cities here.
Yeah, I know that.
What about you, Christian?
I just want to go home to Beijing.
Welcome back.
That's number one priority for me. Yeah, I mean that's where everything is. That's where all my friends and coworkers are. My in-laws are still there. So, it's an unplanned trip to be away from Beijing for this long, and I really want to go back. And when we're back there, Aldo, come to Beijing. Let us know. We'll show you around.
Okay,
Yeah,
Great.
man.
You can band together and visit a lot of places together.
Yeah, it would be my pleasure.
北京欢迎你. Thank you. Roz?
I would love to go back to China as well. Of course, to see my friends again. But actually, one place I want to go to is Huanggang.
Why there?
It's a city in Hubei because Huanggang,
I
because
know
there
that.
is
Guangdong?
Huanggang. Sure. It's a city where we have donated many masks to the hospital there,
Okay, I get
and
it.
it really want me to see the situation there right now. And I never been there, and obviously going to Hubei and traveling there, making videos there, show the world what it's like. I think it's a great opportunity to show the world more positive sides of this area and not just the sad stories from the last few months. And of course, I want to go watch a football game. So anywhere, I would go to England to watch Chelsea. I would go to Spain to watch Barcelona. Anywhere there's football, I miss it. Where's my football games? I miss my football games.
And to be clear, for all those sports fans, it's really excruciating, painful period. We can't watch any games at now. That's really.
I've been watching many games from the past. I've been watching like from 2001. Like
But
I've
it's
been watching.
different to watch games
It's
live and
different.
watch games of the past. All right.
That's true.
I
That's
hope
true.
your dream will come true sooner. What about you, Lida?
I hope so
Where do you
too.
want to go?
I mean, obviously, I want to go back to Beijing, but if we're just talking about travel, then I actually really want to take my dad to Guangzhou, because I think he would really like it there, and I really like the food there, and I think he would like it too. So I really want to do that once things go back to normal.
And I know that you've been doing social media a lot, and for our overseas Chinese influencers, how do you view this pandemic will end up like, and to what extent it will change our lives, our views, our values, and our outlook for the future? Let me start with Leo.
Well, it's a very complex question you ask. I think on one side it will bring communities together, and I think that's a very positive thing. It's been an experience where people have helped each other. I think, however, the economic problems will last 4 to 5 years, and I think actually it'll have a terrible effect on international trade. I think that many countries will start to move trade back home because they've seen the difficulties that can happen if they're not producing things they need, like medical equipment and so on. So I think we have to fight as a whole to make sure we stay as one world, and we don't just strengthen our local community, we strengthen our global community. And that's going to be a big effort for all of us, but let's do that.
And probably this is also our viewers want to know. Aria Chan, through YouTube, she asked, did you guys make any permanent life changes because of the coronavirus? How will this change our life? This is important. Jampong.
Not so much. I live normal life at the moment, so keep staying at home. I haven't go out shopping for like more than a month, but this is normally my life before this corona. I stay like most of the time at home. I'm still working.
Mm-hmm. What about you, William? Apart from
Yes.
becoming a dad?
Yes, I think the biggest way this coronavirus is going to change is the way how we work. Like this, we are connecting to each other remotely, and I think working remotely will be as normal as Chinese using chopsticks in the future.
Great. Rezo?
Well, what this coronavirus brought to us was that it made the world change. It made people understand that they are all connected, I mean, physically and energetically. So I think, beside all the bad effects that it had to the world, it also had so many benefits to people and to the world.
Great way to put it. Odo?
Yeah. Uh, yeah. Yeah, I think for me it changed everything, because my work is like it's about contact with people and giving them music and art. It's like it's better when you live it in person. So for me, it changed everything. I think I I found this new way of sharing my music, and I have to get used to this because I think it will go on for some other months. But I will, I don't know. I hope we will go back to normal soon, as soon as possible. I really miss that connection, with people.
Yeah, we all do. We all miss the connections like
Yeah,
we always do. And
yeah.
Christian, and how do you view?
Connections are just different now.
Yeah, yeah, it's different. Christian, how do you view this will end like, and will that change you as a person?
Well,
Are you
I mean,
speaking with
I
me?
think that,
Oh,
like a
sorry.
lot of people
I'm
mentioned
talking to
already,
Christian.
our work habits and everything are going to be changing. Yeah, I think it's going to be changing our work habits, and people might stay online for a lot of, non-essential work stuff. I mean, my business partner and I, we always used to say that we need to be in the same exact room to get anything done, and we've learned that that's not necessarily the case. But I think from more of like a social aspect, what I really hope is that it, teaches us to put our phones down, because so many people spend time together and they're staring at their phones the entire time. And they feel like they have to be connected to their phones, and now we realize how quickly we lost that actual physical contact or face-to-face contact with people. I'm
And
hoping
we
that
all
when
miss
we
that.
can get back together, people will actually pay attention to the person sitting across from them, instead of going on Bilibili, Weibo, YouTube, Instagram, whatever it may be. Actual human contact with the person in front of you is what's most important, and I'm hoping that people will change and see that, like like it was 20 years ago, 30 years ago for people.
Exactly. That is really important, because the change of life also makes us think about what is important in life. That is really
Yeah.
very important. What about you, Roz?
Wow. I just hope that we all pay attention more to the real heroes in our society, which are the doctors, the nurses. I think we manage to really, in the future, we will all be very, very appreciative of these people more. I think we will take more care about their situation. We'll give them more funding. We'll give them more materials. We'll be more prepared for the next, if there is a next epidemic, we must prepare better. And we will be able to, I think as a whole, we'll be able to understand which are the people that are really fighting for us, as well as paying attention to the elderly. I think that's something that, you know, they've been suffering so much from this. That's the most. They're the most deaths, the most sick. And spend more time with your grandparents and your parents when you can. This is tells you something like this comes and might endanger their lives. So why not give them more phone calls, see them more as you can? I think these are the real heroes in our lives, our families and our doctors. And that's pretty much what I have to say.
Yeah, keep close to your families. That's always number one. Thank you, Roz. And Lila, what do you want to say?
Yeah, like Raz said, I think this is really a learning experience on so many different levels. And I also think that, if we can get through this, we can get through anything. Because right now, doing, anything, even things that used to be so simple, like having a meeting have become so much harder. So it's kind of like, I feel like, you know how sometimes like when you work out, you put like weights on your arms or on your legs, and then your whole workout becomes really hard, but it's making you stronger. And then you take off the weights and you feel like so strong and you're so much better all of a sudden.
Wow,
I
that's a
think
good
that like the
metaphor.
coronavirus is kind of like our weights. And once, you know, we get to take off the weights and everything goes back to normal,
Yeah.
you know, we'll all enter back into regular lives in full force and become stronger than we ever were.
So interesting. Thank you all for your wonderful ideas and sharing this with me. The fact that we are talking in this way says a lot about the world that we are living in. Maybe COVID-19 has changed our lives one way or another, but we are talking about it. We're dealing with it. The fact is that we are in this together. So why don't we end with shouting some slogans showing that we are in this together? Let's say the slogan that we have: fight as one, 战疫情战一起. Let's say it together. 1, 2, 3. Fight
Fight as
Fight
one,
as
Fight as
one,
one.
战
战
疫
疫
情，
情
战疫情。
战疫
Fight
情.
as one.
Thank you so much. And at last, I'd like to invite Mr. Aldo Cecchini to play some music for all of us so that we can end with a happy note. Aldo, play
My
some
pleasure.
music for us.
Okay.
Woo.
Bravo.
Wow.
Bravo. Thank you so much, Aldo. And keep
Thank
up the
you.
good
Bravo.
work. Play the music to your neighbors and families, and please play the music to us later on in the
I will.
future. Thank you very much, everybody, for
Thank
spending
you.
some
Thank
time
you.
with
Thank
me.
you.
Thank you.
Have a good time.
Thank you.
Bye-bye.
Everybody
Bye.
stay safe.
Bye.
Bye.
Bye,
Thank
everyone.
Stay
you.
safe, stay home.
Thank you, everyone.
Bye.
Bye. Thank you.
Bye.